Hi, Chris. Good morning, Doc.
Yes, morning, Doc. We wanted to give our colleagues 5 minutes. I think we can start in 1 minute. I was just trying to mobilize different sub-county teams so that they can join. You can see we are 28 of us. So probably in the next 1 minute, we'll have a huge number join the meeting. So I think we can
start at 9:10.
We can start at 9:05 because of time and other activities. So I wanted to just highlight the conferences that we expect, especially the international HIV conferences. But before that, I wanted to, as it is our custom, we always start with a word of prayer. So volunteer to lead us in a word of prayer, kindly. Volunteer. Anyone? Someone to lead us in a word of prayer. Irene? Irene, are you able to speak? Irene Aoko? Anyone? Hi, Karen. Yes, Waitaka.
Good morning. Let us
Morning.
pray.
Sorry, I'm on the road, but I can see the screen.
Yeah, I think Waithaka can pray for us. You will pray next time, Karen.
Okay.
Yeah.
Let's pray. Almighty God, our Father in heaven, we are grateful for this morning that you have given to us. As we start our meeting, as we start to learn, we pray that you give us the knowledge, wisdom that we require, that in all we do this for the honor and glory of your holy name. Guide us and lead us. This we pray in the name of the Father, the Son, and the Holy Spirit. Amen.
Amen. Thank you, Waithaka, for taking time to, of course, open for us in a word of prayer. It's very important to start with God. So I can see we are 35 of us, and some of us might miss on this very important series. So let's mobilize our teams. I know we work, and of course, a number of us, we also have colleagues. We have friends who might benefit from this very important CME. So I want to dive into what you are seeing on your screen. So we have 3 main international HIV/AIDS conferences that usually we mobilize for our teams to get support from the implementing partners and also the development partners. This international conference occurs every year. Of course, during the COVID time, they were virtual, but from 2021, if I'm not wrong, 2021 or 2022, we resumed the physical, but nowadays, most of them are hybrid, whereby we have some of participants following physically at the venue, and then we have other participants following virtually. So I want to go to the first one, which is just to set the mood as we wait for our colleagues to join. So we have this conference. It's called ROI, or Conference on Retroviruses and Opportunistic Infections. So for these years, CROI, it was hosted from 19th to 22nd February. That is in Seattle, Washington. I know some of us from Kenya were able to attend this physically in Washington. So the next one will be held next year. That will be the 31st CROI. Will be held from March 3rd to March 6th, 2024 in Denver, Colorado, USA. So we can start following. They have a website where you can start following the 31st CROI, so that we can start preparing to attend in person through, of course, abstract presentation. And if you are doing a research that may intrigue the organizers and the people who review those research writings, you can also forward during that time. They will open probably around September or October for abstract writing and abstract submission. Then we have number 2, what we call IAS. So we have it is the 12th IAS, that is International AIDS Society Conference. This one will be happening next month from 23rd to 26th July at Brisbane, Australia. It will also be done virtually. So those who will not be able to join physically, you can also register to join virtually. I know there is some financial commitment that you need to make, but with our partners, you can be able to get support to attend, and especially those who have submitted the abstract for this conference. So this is another very important conference. We get a lot of support. We get many people attending. Last year, this conference was in Canada. I can't remember the city, but it was in Canada last year. So some, even my colleagues were with today in Machakos. Some of them attended. They were talking about it yesterday. And of course, the support came from our implementing our partners that supported them to attend such a very important conference. Remember, conference also comes with a number of CPD points, I think 10 per day. So if you attend for 3 days, you already have your 30 CPD points. I hope you can hear me. Okay, I've noted. Yes. So the last one is this one. I think for this conference, we have the abstract submission, I think, is already closed. But for this conference of we call it ICASA. ICASA is International Conference on AIDS and STIs in Africa. So it will be held on from 4th to 9th December. And abstract submission will be opening soon. There is a Zoom call that will be happening on 30th June 2023 at around 1 p.m. Ghana time. So let's prepare our plan to attend this Zoom meeting. It will be talking about how to write abstract, and especially for the ICASA 2023, it will be happening in Zimbabwe, Harare, Zimbabwe. So we can start planning as early as now, at the moment we understand how to do this CME, this abstract writing. Good. I want to stop there so that I can invite Violet. Will be taking a maximum of 40 minutes because she's also going for another meeting. Violet, you can take over. I think we have 45 of us. Okay, someone has Violet has said that the abstract submission for ICASA is now open as from 1st June. It will close on 30th July. So we also need to be to start submitting abstract for that very important conference. So let me invite Violet to take us through the second and the last part of the abstract writing. Welcome, Violet.
Okay, thank you so much, Doc, and thank you, everyone. Welcome back to our second session, and I hope we will conclude this with some better decisions on how we can be able to go about writing abstracts for the next scientific conferences. And thank you so much, Chris, for taking us through that opening session, just to also motivate us that there are other avenues that we can be able to utilize to submit our abstracts. So I'll be taking us through the next session, and we had agreed that in this session we will cover the second last parts of the abstract, and then briefly just summarize a complete abstract. So I don't know whether we can remember what the sections of the abstracts are from the last meeting. From the last meeting, anyone who remembers the section? Okay, we can go ahead and type in the chat in case you remember. So we talked about option 2, which is the most appropriate as we prepare for the national conferences. But as well, we also talked about option 1 that also focuses on scientific writing, especially when you are doing an analytical study that you can be able to submit to test hypothesis and submit to the IAS or other scientific conferences. So we mentioned that background normally summarizes the purpose of the abstract, the problem or rather the issue that you're talking about, and then the objective of your project. And then the methods section or the description usually talks about the period, the location, the structure of what you did, and then the interventions that were undertaken for that particular project. And then for the findings or the results or lessons learned, this normally gives us a summary of the findings or rather the outcomes of your project or analysis that has been done or evaluations or lessons learned and best practices from implementation. It also summarizes specific results and support your lessons learned and best practices. So basically today we are going to look at this section of findings and then the next section on next steps or conclusion, which basically talks about explaining the significance of your findings, and what you can be able to draw from the implementation. So this is just a reminder of our checkboxes. We talked about the different checkboxes that you need to have as you talk about a section of an abstract, and we agreed that in a title, a good title should have the what, the where, the who, and the how. And then a good background should have the topic, the problem, the issue, the objective, and the aim. A good method section or description section should talk about what, where, when, who, and how. So the emphasis here is that basically, once you write your title, we expect that whatever is in your title is what you're going to talk about in your method. That is why this is a very serious section for that usually takes time to write and explain. Majorly, it has it can take the largest part of the abstract together with the results section. So today we are going to look at the results and basically just see what are the checkboxes for results and also the conclusion. So this is our section 3 of the abstract writing. So when you talk about results, basically we are referring to the key findings. And in this section, this is where we include data. This is where we do analysis and share the analysis results. And normally it is advised that this section is written in past tense, similar to method section. Those two are usually written in past tense. So one of the things that is encouraged when you're writing your results is that you need to be very specific to talk about results that are aligned to your objectives. So remember, when you're doing your abstract, based on the instructions of the conference that you want to submit the abstract on, we said your objective can be included in the background as the last section of the background, or maybe if the scientific conference asks you to write the objectives separately, then you will be able to write the objectives. So when you are doing your results section, always look at the objectives, and then so that as you write your results, they should be aligned to the question that answers your objective. So I just want us to look at an example that I just picked from one of submitted abstracts to look at the results section. And this is an abstract that was done looking at cervical cancer screening. And we will see the whole abstract later, but just looking at the results, which talked about the women who were tested. So we assume that this abstract was basically referring to women as the population. And then the intervention was HPV. So the results are showing that 97% of women were tested using HPV, and 35% tested HPV positive. And out of that, 50% were linked to VIA. And then out of those who were linked to VIA, 54 were VIA positive. And then 2 further were suspected to have cancer. And then it also talks about 63% of the women being treated with thermo or cryotherapy, and 29% being referred for specialized treatment. It also talks about the turnaround time for the results. So basically, when you read these results, you are getting findings from the study, and it is demonstrating things that you would want to see if they are aligned to the objective. And as you can see, you can clearly draw a cascade from testing to positive to referral to confirmation to treatment. So there is a kind of a flow of your results based on what you wanted to write. So just picked this as an example, but you will be able to look at a full abstract and see how that now flows and aligns to the objective. So the next part is the conclusion part. Remember, conclusion is a very small part. However, looking at what has been published out there, it is usually said that conclusion is the most difficult part to write in an abstract. Yet, conclusion is just a very small section that has few words, but it is the most difficult. Usually the easiest part to write is the results section. This is because remember when we said a checklist of what you need to have before you start writing an abstract. So if you have your data, it is very easy to write your results. And scholars say that when you want to write a good abstract, start with the methods section. So it's not like the order of how it should be should follow the sections, like you must start with the title, but you can even start with the methods to just write what you did and then what you found. And from that, based on what you found, you can do now your background based on what you found, and you can now do your conclusion, and even now finish with writing your title. So section 4 is the conclusion and recommendation, or rather the next steps. And this section basically summarizes the main findings. So it reflects data as presented in the results section. So when you are writing your conclusion, you are interpreting what your results say. You when you're making recommendations, you are doing implications of what the findings were, and then maybe also recommending for what needs to be done in future. So basically in this section, you are bringing the take-home messages to the reader or to the audience that following this study, following this implementation, following this case, these are the take-home messages. These are the things that we can be able to learn from this particular abstract. And it's usually very brief. You can write 3 to 4 sentences at maximum, basically aligning everything to the results and the objectives. So there are usually things that are avoided when you're writing your conclusion. One of them is don't write obvious statements. Like, for example, when you're writing an abstract on NCD uptake in Mbagathi County Referral Hospital. So you just write an obvious statement and say, NCD was found to be a problem among women. So this is like just an obvious statement. It is a problem among women, but we want you to specifically talk about what did you find in the results, so that you can say, from the study, we can maybe we can conclude that NCD prevalence among women is higher than men, because you have data that you are using to support your conclusion. Avoid repeating results in the conclusion. So if your results say prevalence of NCD among women is 49%, and you have written that in the results section, do not repeat to say, we found that NCD prevalence was 49% among women, higher than men. So that will be a repetition. Then also avoid overgeneralizing. For example, you've just done your implementation in Nairobi County, but now you want to tell people that following these results, we can standardize the use of maybe an intervention that you have done across the country. So unless this has been scientifically tested, what you do is you just recommend and make suggestions, not necessarily generalizing to conclude that this is now what is going to be done moving forward. So basically, those are the things that we need to consider when we are writing our conclusion. I want us to just look at these examples of conclusions and be able to see if there is anything that can make it a good conclusion or a bad conclusion. So we have 3 examples. Example 1, nutrition interventions with a focus on household food security are a more sustainable form to support PL-HIV. The project should be adopted to sustain CAGs. The second one, community approach to TB-HIV diagnosis is key in case identification and should be advocated to reach the patients with stigma of visiting health facilities and constrained with support with transport costs to facilities for health services. Universal health coverage should be embraced. Healthcare workers need to be refreshed with TB and HIV knowledge through training and through continuous medical education on regular basis to enhance confidentiality in diagnosis and management of TB and HIV cases. Then number 3, there is need to scale up and sustain TB active case finding at the outpatient department and other service delivery points. So among these ones, which one do you think will be a good conclusion based on what we've just discussed? Doc, I don't know whether I've been audible ama nimeongea tu and I've been talking to myself.
No, we are following. We are following.
Okay. So anyone can type in the chat between number 1, number 2, number 3. Which one do you think will be a good conclusion for an abstract?
Number 2.
Number 2. Okay, somebody says number 2. Jace also says number 2. Rahab says number 2. So as we put our suggestions, remember we said when you're concluding, you have to stick to your results, and also it should be aligned to your objectives of the implementation. You are not, you should not introduce something that is very new, that is not necessarily aligned to what you are talking about. So as much as we don't know what these abstracts are about, but we can easily tell if the sentences match to each other, if they are talking about one thing, and if they are using terms that are acceptable or not. So we said you don't overgeneralize. And we also said you don't write obvious statements and you don't repeat results. So fortunately, in these 3 conclusions, there are no repeated results. So in number 1, okay, so I'm getting different suggestions, 2 and 3. So number 1 has not qualified. So number 1 says nutrition interventions with a focus on household food security are a more sustainable form to support PLHIV. The project should be adopted to sustain CAGs. So when you link nutrition interventions and you also link CAGs, something looks to be amiss in this, although, so in your conclusion, you don't introduce new things that you did not talk about in the abstract. So that is just one thing to note. In the second one, it's talking about community approach to TB HIV diagnosis is key in case identification and should be advocated to reach the patients with stigma of visiting health facilities and constrained with transport costs to facilities for health services. Universal health coverage should be embraced. Healthcare workers need to be refreshed with TB and HIV knowledge through training and through continuous medical education on regular basis to enhance confidentiality in diagnosis and management of TB and HIV cases. So this looks like a very good conclusion. However, it has some additional information that we don't know where it is coming about. So generally when you read, you pick it that this abstract is talking about TB diagnosis, but then we have something on universal health coverage which should be impressed, but we don't know anything. We cannot relate other sentences to universal health coverage. So again, just emphasizing the point of not introducing new things in the conclusion, but this would rather be a very good conclusion. There is need to scale up and sustain TB active case finding at the outpatient department and other service delivery points. So anything wrong with this? Anyone who feels they can say what is wrong with number 3? What makes it not a good conclusion? So maybe when you are writing a conclusion, you don't use like commanding words. Should be advocated, need to scale up. So use of such words may sound like you are commanding. So maybe this would have been rephrased to scaling up of scaling up TB active, scaling up of sustaining TB active case finding at outpatient department and other service delivery points may be necessary to impact maybe on the now objective that was studied on, because here we don't know what the objective would have been. So just rephrasing this will also make it a good conclusion. So let's look at some of the tips for writing a good conclusion. You need to ask yourself these questions. Was my hypothesis correct? Was the objective achieved? So once you have your objective right, as you write your conclusion, you look at the results. Did I achieve my objective? If my hypothesis was to confirm whether prevalence of hypertension among women is higher than men in Mbagathi, then what did the results say? So if the results confirm, then you can be able to make a conclusion related to that. If also ask yourself, if my hypothesis is partially correct or entirely different, what can be learned from the results? So also looking at what your results are, what do you learn in case your hypothesis was opposite? And also ask yourself, what is the take-home message that you want the reader to live with? So that will give you just 3 sentences, 2 to 3, maximum 4 sentences to write in your conclusion. Another example of a conclusion related to the results that we read above. HPV prevalence in this population was 35%. Preliminary data from the pilot indicate that HPV testing is in women living with HIV was acceptable and feasible, with the majority of HPV positive women linking to care and receiving treatment on the same day they received their results. As this study is ongoing, we expect linkage rates to increase with additional follow-up. Additionally, in resource-limited settings, thermocoagulation and cryotherapy are practical approaches for prompt on-site treatment of VIA-positive women. The pilot results are expected to inform the National Cervical Cancer Control Program in Uganda in the adoption and implementation of HPV testing as the primary cervical cancer screening method nationally. So this conclusion is basically talking about what the findings were in terms of HPV prevalence and also the cascade. But then remember, we talked about not repeating results in the conclusion, but we can see that element there. However, we have very good suggestions in terms of recommendations in this conclusion. So the conclusion addresses the prevalence of HPV. It addresses acceptability in terms of whether that was the hypothesis to measure acceptability. It talks about the future in terms of what needs to be done as a recommendation. And it also talks about the interventions, whether they worked or not. So this will be a good kind of, not necessarily a good conclusion, but just kind of a good conclusion that captures the major things that you'll want to see. So just a brief knowledge check. I see, Chris, the number of people attending increasing towards the end.
Yeah.
Okay, so a brief knowledge check. So this is an example of an abstract. You remember when there is a call for abstracts, they are usually submitted and reviewed. So this is an example of an abstract that was submitted. So I want somebody to type in the chat whether you think this abstract was accepted or not accepted. And if it was not accepted, what were the reasons? If it were accepted, what will be the reasons? So we just have 1 minute to that. Do you think this abstract was accepted or not accepted? If it was accepted, why? If it was not accepted, why do you think it was not accepted? Is there anyone? Oh, we are still reading. Okay.
Vayo,
Uh-huh.
Peter here. I'm just looking at the title,
Uh-huh.
the what, where, who, and how. So there are a
Uh-huh.
few elements that are missing first in the title, so which
Uh-huh.
makes the the abstract acceptability a bit difficult, because it's talking of cervical cancer screening among women of reproductive age. So we know the who, but where is not indicated. Perhaps it could have talked of maybe attending reproductive health clinic at a particular facility in a particular region. So that one is missing. So somebody reviewing this abstract would really be hesitant to accept based on that. Let me study the rest of the parts.
Thank you so much, Peter, for that.
Thanks.
That's very clear. I won't add anything. Okay. I want to volunteer to talk about the background. Okay, so Gracia has said the abstract format also. So we see an introduction of a different format of background, demographic, objective activities. So in my field of practice, I haven't seen a format like this, unless maybe it is instructed by the conference that is that has called for the abstract, but this one looks a bit different. So I agree that the format is a bit off. Any other person? Okay, so Judy is also saying that there are unnecessary details added in the abstract outline. Charles says the objective is not also clear. So objective is to improve cervical cancer screening among women of reproductive age to 80% at end of September 2022. And clearly an objective has to be SMART, and it is missing the where as well. Any other person? 30 seconds. So again, it becomes very difficult when, yes, go ahead. Somebody has unmuted.
Oh, I was just looking at the format again. The format is not followed, considering that most abstracts are between 400 to 500 words. And you have all these statements. You've not done your methodology, you've not done your conclusions and recommendations. They're already exceeding the recommended standard wordings that are acceptable. And then the arrangement looks like you're actually bringing the entire research and not just picking the key things that people need to understand and see. So I think that's another challenge that this type of abstract is demonstrating here. Thanks.
Okay. So thank you, Peter, again. So it is very difficult for the reviewer to make to even make a decision on this, and definitely they will just leave it, because reviewing follows a format: what is in the background, what is in the methods, what is in the results, and what is in the conclusion. But clearly that format is not well followed. So it makes things very difficult. We don't know what the conclusion is. So it is like an incomplete abstract. So that now brings in the idea of the checklist. So whenever you are completing your abstract, just ensure that your checklist is complete. That will save you missing marks on whether your abstract, especially when you're submitting for the international scientific forums. So thank you so much for those who have given their inputs, and also those who intend to give, and those who are still reading. I know that this has given us an insight. Just think about how we can make our abstracts better. So moving forward, so this is now a complete abstract of what we looked at, and this is a published abstract. That is why I've picked the whole of it. So once it is published and it is accessible, it means that anybody can be able to access it. So it has no like limitations of whether we should use it or not. So this is a complete abstract that was submitted on HPV testing on self-collected vaginal samples as a cervical cancer screening method among HIV positive women. This is a study in Uganda. So can we see the 4 elements there in the title? The who, HIV positive women, right? The where, Uganda. The how, the intervention was the HPV testing on self-collected vaginal samples. So that is the how. So this will be a good title in my view. Somehow it can pass. And then, so this is not so much necessary. These are the authors of the abstract. You will always get guidance from the conference instructions on how you write the authors and their affiliations. And then the background reads, cervical cancer incidence and mortality is highest among women living with HIV in low-income countries with limited access to cervical cancer screening treatment. The WHO currently recommends HPV testing as part of cervical cancer screening programs. In Uganda, cervical cancer is the leading cause of cancer death, but only 10% of women are screened annually through visual inspection with acetic acid. A study is being conducted in Uganda to assess the acceptability and feasibility of HPV testing using self-collected samples for women living with HIV. Do you think it has the 3 elements that we talked about, that background? Anyone? You can just type. Does it have the issue? Does it have the problem? And does it have, or does it talk about the topic? Does it talk about the issue? And does it have the objective? So I can see the topic being cervical cancer. It has been well talked about, and even the issues globally. And then the problem itself within Uganda of 10%, only 10% of women screened. And then the objective is assessing acceptability and feasibility. So I think this is a good background because it captures the 3 areas. Then the methods. Remember the who, where, what, how, and when. So in this observational pilot, so this is the methods. So this is the how. This could be able to capture the how. It is observational pilot. September 2019 to March 2020 in 7 Ugandan hospitals. So here we have the when and we have the where. Self-collected vaginal samples from women living with HIV are tested using GeneXpert. Data is extracted from facility registers. Descriptive analyses are presented here for data through December 2019. So does it capture again the 5 questions? Anyone? You can just say where and indicate what it is, who, indicate what it is, when, indicate what it is, what, and how. You can take 1 minute. How much time do I have? Oh, I have just. Okay. Anyone, are we together? We are on the methods.
Yeah, it's a good one. Violet.
Yes.
Yes, I think the method is fine. It's talking of the design. It's an observational pilot. We have period, which is when. It was September 2019 to 2020. Where is Ugandan hospitals? How? Self-collected vaginal samples from who? Women living with HIV and AIDS. So I think the elements are captured here.
Okay. Thank you so much. And I agree with Peter. Ni Peter tu anaongea.
And the data source is also there, extracted from facility registers, which is very good.
Yes.
And the descriptive analysis. Yeah.
Yes. So this is a very, see how brief it is, but it is capturing all the necessary information. So let's look at the results, and I agree with Carol as well. Carol agrees that those elements have been captured. In the results, they are saying 1021 women were tested for HPV. 97 had valid results, 35% tested. So you remember we went through this example. So what we want to see is, are these results aligned to the objectives? The objective was to assess acceptability. So how do we assess acceptability? What are some of the variables? So acceptability will be measured by uptake. And here the uptake is 97%. So we can be able to see. And then if you're looking at this abstract in terms of feasibility, so is it something that can be rolled out? So among, because in the background, they talked about visual inspection. Only 10% of women are screened annually through visual inspection with acetic acid. So the study was being done on whether HPV can be used instead of VIA as the first screening test. So we want to see whether it is feasible to use HPV against VIA as the first screening test. And clearly from these results, we can see that 50% of the women were identified and even linked for VIA testing, and then the cascade continued. So clearly we can be able to link the results to what was talked about here. Also, turnaround time can also measure feasibility in terms of is it now delaying intervention, or is it now improving efficiency in intervention. So that is also a result that can also talk about your objective. So remember, whenever you are talking about your result, you should link it to your objective. And then for this conclusion, again, as we had said, because it has to now tell us in the hypothesis on whether HPV is acceptable and feasible. So we want to see here in the conclusion whether that has been discussed. And clearly it says preliminary data from the pilot indicate that HPV testing in women living with HIV was acceptable and feasible, with the majority of HPV women linking to care and receiving treatment. So to me, this conclusion is also aligned to the results and objective. So when you are reading through your abstract, just check in the check boxes, are you meeting what is expected to be in that particular section? If you miss out on something, you can still go back and review, because when you're writing an abstract, it is allowable to review as many times as you can, as long as you meet the timelines for submission. So we can proceed. So basically, this is just, in summary, what makes a good abstract. It should have an attractive and short title. It should be coherent and with concise paragraphs. You remember the example we had? It should be in the correct order of the main parts of the structure. It should follow strictly the chronology of the study. So you don't first start with results and then go to conclusion and go to methodology. You need to tell us what you did first before you tell us the findings. It should be presented with logical connection. So the flow should be there. No new information should be hanging. You remember some of the examples of the conclusions that we looked at had some hanging information introduced there. It should be in an understandable language. Try to avoid terms that are not understood. And it is always encouraged that when you are using abbreviations, always define them the first time you are using them, but avoid abbreviations as much as you can. Do not include citations or abbreviations that have not been defined in your abstract. And most importantly, know who this abstract is going to be presented to. So know your audience. It helps you much to capture the necessary information. Some of the things that you need to avoid, as we have said, abbreviations, acronyms, symbols, citations, references in the abstract, but there is a difference between a manuscript and an abstract. So in the manuscript, you have all those details, but in the abstract, you are encouraged to avoid such. So in terms of submitting your abstract, what is expected? So before you submit your abstract, consider the following. Number one, when you're writing your abstract, remember it is work that is done in the health setting, and most of the work is accomplished by a team. So that means that you need to acknowledge the people that you have worked with for the abstract. And so you can either ask them to review our abstract, or for example, if you're submitting for IAS and you have done your abstract through a partner, you will need approval by the funder, that is CDC, before submitting that abstract. So because if you will need support, as Chris said, in terms of funding to travel, you will require approval either from the donor or the agency or the program. Then there are forces that you need to consider when you are submitting your abstract. One is completeness. Two is conciseness. Three is clarity and cohesiveness. So if you follow the format that we have discussed, these four elements will easily be captured. Check instructions for the conference that you want to submit. And we have very good mentors. We have our lead mentor, we have other program leads, other TA members who can be able to help us to share, because whenever a conference is announced, they usually send abstract submission instructions. So it is good that you read, especially Peter talked about the number of words. Different abstracts have different limits of words, but majorly 300, 350 to 500. So just read the instructions, ensure that you are meeting the guideline. Then always remember to submit your abstract within time, because normally when you submit your abstract late, it may not be accepted. So just one knowledge check. What makes a good abstract? So you select all that apply. So one with coherent paragraphs, is that correct? You can put in the chat 1, 2, one with an attractive and short title, 3, structured in chronology, 4, introduces new information in the conclusion, and 5, it is understandable language and avoids jargon. So which one do you think makes a good abstract? Kennedy says all except for. Any other person? Judy says all except for. Okay, 1, 2, and 3. All except for. All except for. Okay, so we've just said that when you want to write a good conclusion, a good abstract, you should have your paragraphs talk to each other. You should have a short and attractive title. The paragraph should be coherent, and there should be a chronology in terms of structure based on the instructions, starting with background, methods or description, results, and then conclusion. It should be a language that is understood, except do not introduce new information in the conclusion. So I think 1, 2, 3, and 5 apply except 4. So this brings us to the end of our session, and I welcome any questions related to this. I'm hoping that moving forward, we can be able to now write a good abstract, and we are ready for the national conference and even CROI 2024.
I have a question.
Yes.
On how to submit the abstract.
Mhm.
Down there, it was saying that consider the track and subcategory. What is track?
Okay. Chris, would you mind to just share the, I don't know whether I have it on my desktop, but you can share the national.
Yeah, sure.
conference
Let me
and-
share. Let me share.
Okay.
Okay, 1 minute.
So every conference usually have selected themes for submissions. So a theme may be very broad, like for example, it can talk about quality improvement, but under quality improvement, you have sub-themes that are called categories. So every scientific conference usually has such. So you will have a broad theme, and then you will have the sub-themes, which are now called the...
This one?
Yes, so scroll down.
Which part?
Yes, so this one.
Uh-huh.
So you see this one says abstracts are welcome on the following topics. So these topics are the major themes that have been selected for submission of abstracts. So they are named 1 to 15, but under each one of them, so you can continue, you can scroll down. There are so many, there are 21, but under each one of them, so continue scrolling down.
That is also an outline on how to write it.
Yeah, so this is now the outline that has been shared by the, so this is now the one that we are going to use. You will have your background, your objective, your methods, your results, and your conclusion, recommendation, or implications. Continue scrolling down. Yes. So this is now the detailed scope for abstract topics. So remember we had the 21 topics up there, but now under every topic, you can write something. For example, under my antimicrobial stewardship and antimicrobial resistance, you can write on building an antimicrobial stewardship, epidemiology, surveillance, strategies, novel antibiotics. Just continue scrolling down, Chris, so that I use an example that is easy. So like this one, the topic or the theme is advanced HIV disease, opportunistic infections, TB, and viral hepatitis. Under that, you can write something about cryptococcal meningitis, TB and HIV, hepatitis B, sexual transmitted infections, case presentation. So these are the different categories. So this is for the national one. When you open the ICASA, sijui kama uko nayo, Chris.
No, I don't have the ICASA one, but of course I can. As you continue, I can get it from the internet very fast.
Yeah, I think I had opened it somewhere.
So I can stop sharing, so that yeah, I saw somewhere you. So you can share that.
Okay. So let me share the screen. So on the ICASA one, which is, it has details, guideline on abstract submission. So on the guidelines for abstract submission, you will get all those details. So here, the call for abstracts, 1st March 2020, end date is 31st July 2023. And so you have 163 days remaining. So when you click on abstracts, you will have, you will have track descriptions and submission guidelines. So when you click on track descriptions, you have different tracks. Unaona kama those ones for NASCO, the 21 tracks. Now this one has 5 tracks, and each track, for example, clinical science, treatment and care. When you open it, you have the description of the track and you have other sub-tracks. Under it, you have themes on clinical cause of HIV infection, and you have topics that you can be able to write about. So those are the categories that you submit with. So when you are submitting, you will get instructions. In the instructions, you will be told, indicate the track and category. So you indicate your option of the track, and then you select the category of your abstract. And this can be guided by your mentors. Thank you so much. So let me just copy this URL and paste in the chat so you can be able to open to access that.
Yeah. Yeah.
When you click on that, you will access the information for the class. I've just pasted in the chat. Thank you.
Thank you, Violet. And to remind you that whenever you are submitting abstract or you are working on abstract, kindly involve the implementing partner, because at the end of it all, you will need their support for your travel and of course other logistics when you go, especially for international conferences. So don't forget to, if you are CDC supported, make sure that you've involved people from CDC through the local implementing partner. If you're USID, the same AHF or that, so that at the end of, if your abstract is accepted and you need to travel, they will be already aware that there is such a, so that you make our work easier as we push for you to be supported for traveling. Unless there is any other concern, I wish to stop there because of other conflicting activities. But
Thank
we
you
really
so much.
appreciate it.
And
We will
thank
share the
everyone.
recording.
Okay.
Yes, yeah, Bio, continue, Bio.
Yeah, so thank you so much, everyone. I think for those supported by CHEB, you can always reach out to Dr. Wangusi, Dr. Emma for guidance, and Dr. Wafula for any guidance in terms of reviewing your abstract or even mentorship support. But we are there to help you. Thank you.
Thank you, Vio. So there's someone who has asked for the recording. We will share the recording. We will upload it in our YouTube channel, so you'll be able to watch at your convenient time. But of course, we encourage people to join the meeting so that you can get the first-hand information. Unless there is any other concern, I wish to stop there. Yeah, I think everything is clear in the chat. So we will be here to support you. If you need to write a request for support, kindly don't forget to ask so that we can write email on your behalf to the implementing partners for support. And that can only happen if you involve them from the word go. I remember last year when we were going to Kisumu for presentation of abstract, we had a lot of challenges when we requested support to go and present our abstracts in Kisumu. So you need to involve the people will be, you hope to support you. So there is a question probably before we go. Can abstract showcase the success other than solving problems? Yeah, of course, yes, Simon, it does. You can use an abstract to showcase what you have been able to achieve. And that is actually the essence of abstract, because you want someone else to learn from your successes so that they can also implement what you did to achieve the success. So yeah, so we want to end there. So without wasting more time, we will call it a meeting. So bye-bye from me and Violet. Bye.
All right.